Hello and welcome. I'm Dr. Ken, and I'm a medical doctor who passed his OET test. And I'm now helping other doctors and healthcare professionals in order to pass their test. And in this quick presentation, I'm going to give some information about the OET. And I provide some tutoring sessions for the OET for people who need. You can contact with me from this email address, which is oettutordoctor@gmail.com. Okay, so OET test is short for Occupational English Test. It's an English test that assesses English skills of healthcare professionals. And these are these 12 professions. So reading and listening tests are all the same for all these professions. But speaking and writing is specific for your own profession. And OET has been recognized from many countries, including the UK, Ireland, New Zealand, Singapore, and Australia. So you will be scored between from an A to an E. So A means you have very high level of performance, and B means you have high level of performance. In order to pass this test, you need to get at least B. If you get C, D, or E, you need to resit for the test. And you will have your results in 15 business days after the test. So OET is assessed in Australia. For example, if you take your test in Europe or in the US, your test will be sent to the Australia and will be assessed in there. Therefore, there are no local assessors, and even the person who conducts your speaking test is not going to assess you. The recording will be sent to Australia, and it will be marked in there from experienced examiners. And the good thing is there is no set score for the OET. For example, there are like 40 questions and you need to do 30 of them correct. There's no such thing with the OET. The pass note changes in all different sessions of this exam and statistically corrected. So if an exam is hard, it's hard for everyone. So you would get away with 25 correct answers out of 40. But the exam is easy. It's easy for everyone. And you might need to make 32 answers correct. So this statistical correction allows indicating the English level as accurately as possible. And as you see, each candidate's recording is graded by 2 assessors independently. So if one assessor is kind of like strict about criteria and doesn't willing to give notes broadly, that would not affect your score. The attitude of the examiner is also gets corrected statistically. So let's talk about the individual sessions. So there's this listening subtest. Listening, there are 3 parts of the listening test, and previously there were 2 parts, and it's changed with OET 2.0 from September 2018 onwards. So with the listening, you will still have part A. That's going to be a consultation between a physician and a patient or any other healthcare professional. For example, in the August exam, there was a chiropractor, and I heard that many doctors who take the test haven't heard what chiropractor does. So chiropractor is a person who specializes in spinal maneuvers and relieving back pain or strain injuries or bone and ankle deformities. Therefore, you need to be familiar and be prepared for this. This conversation, this consultation could be in between any healthcare professional and the patient. And there were part A and part B in the previous test, but now there is only part A, part B, and part C. And in the part B, there will be 6 short dialogues or monologues that's set in workplace. And part C, there will be a longer presentation. There will be a single speaker who is talking about a topic in depth. For example, a lecture or a seminar or a conference, something like that. And you need to answer a series of multiple choice questions about it. And previously in the OET, there was mainly Australian accents, and there will be international accents in the OET 2.0. But in any case, I strongly encourage you to get familiar with the Australian accent because it can be quite hard to understand if you haven't heard this type of accent before. Because they kind of speak fast and sleazy, and it might be very hard to understand for people who are only familiar with American and British accents. I recommend Australian Medical Journal, AMJ's podcast. They have medical topics in Australian accents, speeches like that. So you might find it beneficial. And for the reading, there also will be 3 parts. In the past, there were 2 parts. And in part A, there will be 4 short texts, and you will have 15 minutes of time to answer questions like fill in the blanks type of questions. So, in order to be successful in this, you have very short and limited time, and you have many questions. You cannot read all the text from beginning to an end. So you need to train yourself in order to find specific information, locate that information with your eyes without reading the paragraph from the beginning to an end. Therefore, these skills are called skinning and scamming, and I encourage you to practice accordingly. And part B and part C will consist of 45 minutes of time. And in part B, there will be 6 short texts in workplace contacts. And part C, there will be long paragraphs and some multiple choice questions about it. And this will focus on understanding the writer's attitude or finding in detail information about the paragraph. So you will be reading the paragraph from beginning to an end in part C. But always read the questions first. So you will know what to look for in the paragraph. You will be prepared for that. And in the speaking part, there will be a role play, 2 role plays actually. And there will be a card like this given to you. And speaking and writing is specific to the profession. For example, if you're going to be a doctor, there will be medicine written in here instead of dentistry. So the patient card will be given to the person who sits across to you. These are just the speakers in there. They're not going to assess your scores, so you shouldn't be worried about what they think about how you're speaking. As I said, these are going to be assessed in Australia. So you will be given this task, and you need to manage your way and make a conversation with a patient. There can be challenging cases like delivering some bad news, like telling someone who has been diagnosed with the cancer for the first time, or like there could be a violent patient or a person who is yelling at you, a person who is worried, a suicidal person. So you need to be prepared for these various types of scenarios. And with OET 2.0, there will be some changes. Like some additions like building relationships, understanding the patient's perspective, providing structure to the conversation, because the conversation that you have between your patients and yourself, there should be a structure. For example, you need to start by open-ended questions, and you need to narrow it down to the close-ended questions. There is a structure of physician-patient communication. Gathering information, because sometimes people can be very reluctant to speak about their health. So you need to get this information out of them, and establishing what the patient already knows. And with speaking, there are like two important things, which one of them is active listening. You need to show that you listen and understand what patient says. You need to say things like, yeah, I see, types of noises when the person across you speaks. And also you need to summarize and reflect upon the speech that patient gives. For example, if someone says, I have really severe back pain, I have trouble sometime getting out of bed, you should say, oh, I see, it must be very hard for you to get out of bed in the mornings. Or if a person starts crying after getting diagnosed with cancer, you should say, it's quite normal to feel this way. Please take time to digest this information. I will help you. We have very good treatment these days, and we will get past it together. So you need to provide this type of understanding and a reassurance. And this is the second important tip, showing empathy. And writing, there will be no changes. You will be given a task like this, and it's also profession specific, nursing or medicine or dentistry. And you need to use this letter format and write this letter to the person who received the letter. So there are two important things. One is saying within the word limits. You need to write between 180 to 200 words. And it's quite important because these tasks are designed to fit into this word limit. So if you write less than 180, you probably left out necessary information that needs to be included into this letter. Or let's say if you overwrite it, if you wrote like 220 words, probably you included unnecessary information to your letter, and these will reduce your score. So you will have 40 minutes of time to write this letter, and you probably will have 10 minutes left. I strongly encourage you to count your words in the real exam, and reduce it or increase it if you had written less than 180 or more than 200. This is very important. And your audience. If you're a medical doctor and you're writing a letter to fellow medical doctor, a referral letter, for example, you need to use medical vocabulary, and you're expected to use that because this person is your colleague and they are expected to know these medical words. For example, if you're writing a letter to your occupational therapist, that person is not a doctor and they wouldn't know these medical words necessarily. So you need to use the language, appropriateness of language, in order to make your letter clearly understood by the person that you're writing this letter. And these are some quick introduction and some changes that are going to be made to the OET exam from September 2018 onwards. And thank you very much for listening to this. And if you need help with your tests or if you need tutoring, you can contact with me from this email address. Thank you very much.